At Scripps, we do real research for real-world patients, and I think that that's our strength. We try to put the patient at the center of the research, whether it's the trials that we offer, the care that we provide, and the survivorship that we all hope for.
We expect a 45% increase in the numbers of patients diagnosed with cancer each year in the United States by 2030. The reason for that is the aging of our population and that cancer occurs more commonly in older individuals. We really need research to address the issues of this emerging population of cancer patients.
If you look across the board, I think we're over 4,000 analytical cases of cancer each year. To me, that's a need. And so patience is something that we have, I think, in difference to the academic centers where they try to attract patients. We have all the patients. We want to provide them an access to the same kind of studies that you can get in an academic center. Unfortunately, we don't have the state funding and the federal funding that the academic centers have to provide that infrastructure.
And I think it's important to note that the public generally thinks that we're still bicycling down the same path toward what the public regards as the common systemic therapy for cancer, that is chemotherapy. In the last 10 years, a whole new class, in fact many classes of new drugs have been discovered that get in the chink of the armor of the cancer. And the reason we really need to concentrate on research right now is there's so many new drugs in the pipeline that we have invented at the bench, and we need to test in the crucible of clinical practice whether they're really going to work.
Currently, the most interesting work that's being done, and it's being done at all Scripps facilities and at all of the Scripps affiliated physicians, are immunotherapy trials across a variety of disease states, looking at ways of tweaking or augmenting a patient's immune system to fight the cancer. So unlike chemotherapy, which directly attacks the tumor, immunotherapy augments your body's immune system to fight the tumor.
When patients first come to Scripps with their cancer diagnosis, they're overwhelmed, they're in shock. Some of them are angry, some of them are just have given up already, saying, I have cancer, that's it. So it's a matter of pulling out all the fallacies, really dealing with the diagnosis they have and being very honest about it, but telling them the steps that are involved, that they can take, their options of what they can take. Research for me is about giving the patient a chance to meet some end needs for their life. Sometimes it isn't remission, it's not a cure, but it's a way of giving them more life to make the critical decisions that they need to do. How much it means to a person to see that grandchild born that they never thought they'd be able to see, a child graduating, or maybe just telling that person they haven't seen for years, I love you, and to be able to spend time with them. Because of research care we have here, I'm now able to, instead of holding a hand of a patient and telling them with tears, there is no more treatment for you, there's no more hope, that this is the end of the line. Now I hold their hand and say, we have a brand new drug that's being tried right now, and you would be perfect for it.
I don't know whether it was good news or bad news, but my daughter was just born the same time I was diagnosed with cancer. And initially when I got the diagnosis, I thought, this is all I'm going to see of her is 5 months of age, and that'll be it.
Jim was diagnosed with stage 3 colon cancer, which is fairly advanced, and he had a successful operation. But at the time, the risk of recurrence at some point would have been about 60%. And recurrent colon cancer is fatal, cannot be cured. So he had a very serious diagnosis. Thankfully, Scripps actually had a study looking at stage 3 colon cancer, which he was able to participate in. Bluntly put, I think he's cured of cancer because of the treatment that we offered him. Certainly the statistics would say that, but I would argue that he got state-of-the-art treatment in a community setting. He had all of the resources necessary, and yet the treatment he got would be as good as any research center in the world.
It's been 17 and a half years since I was diagnosed with cancer. My daughter is now 17 and a half years old. I want Scripps to have the resources to be able to offer clinical trial drugs to other individuals. And through this event, I believe those resources are made possible.